Hey everyone, welcome back to Garner Insights. My name is Nick Reber and I'm the founder and CEO here at Garner. And for those of you who are not familiar with our program, Garner is a simple addition to any health plan that uses data and incentive accounts to drive more care to the best performing individual doctors in the existing health plan network. And today we're going to be talking about fully insured renewals. We're seeing the highest renewals ever, and the question is, what can advisors and employers do about it? So, quick background, at Garner we have over 300 million patients worth of claims data, and we use that to really understand what's going on in the healthcare world. And we're starting to see the highest claims increases ever. So under the hood, what's going on is two things. The first is bounce back care from COVID. We're seeing patients that put off a major test or a major surgery come back into the healthcare system for that required care. And the second thing we're seeing is inflation. And those costs that previously were in the rest of the economy are flowing through to the healthcare world and creating higher physician bills and hospital bills for everyone. So how is this impacting fully insured employers? Well, these claims cost increases are of course flowing through to fully insured renewal costs. And we're seeing that in the data. In fact, here we can see that almost 25% of employers are now getting a renewal rate of 15% or more on their health plan, and that's the fastest ever. And so these employers are really getting squeezed because their sales are weakening in a weaker economy and their healthcare costs continue to rise faster than ever. So what can advisors do to help? Well, the key is really to get out of the rat race of simply negotiating that renewal and then waiting for next year and hoping it'll be better. And instead getting really to the drivers of those underlying healthcare cost increases. And here at Garner, we think the data is very clear that the number one driver of healthcare cost increases is variability in how doctors practice medicine. We see in every geography all throughout the country, doctors practice medicine very differently. They diagnose differently, prescribe differently, treat differently, and have very different health outcomes, and that creates hugely different cost outcomes. And it's not just us. Here is a landmark trial from the Journal of American Medical Association that shows that the doctor is the single biggest driver of healthcare costs. And interestingly, it also shows that the doctors that lower healthcare costs have no worse patient outcomes when it comes to mortality rates, readmission rates, infection rates, etc. So unfortunately, most insurance networks tend to treat all doctors in their network the same. But employers and advisors don't have to when they structure their healthcare benefits. So here at Garner, we create material healthcare savings by improving the quality and efficiency of care and not simply just cost shifting. So what I want to do is go through an example of how this works with you all. So this is a 327 life fully insured group that got a 17% renewal rate from their carrier, and that's after negotiation. And they really couldn't handle this rate. They were already starting to see attrition. They couldn't simply cost shift or narrow the network anymore. So how did we work with this employer? Well, the first step was to restructure their fully insured health plan. And in particular, we went from having a $2,000 deductible, paying nearly $1,100 PEPM here for coverage, and instead we went to a $5,000 deductible plan, and of course got a material rate decrement from their carrier as a result. Now here's where Garner comes in. We created a $5,000 incentive account to cover the employee out of pocket. And that incentive account covers any employee out of pocket as long as that member finds their top performing doctor by using the Garner tools. That means that engaged employees now have a $0 deductible with significantly richer coverage than their old health plan. And because we're able to control which doctors the employees are seeing and get to those higher performing doctors, we're able to offer this at a really attractive rate. So here we offered this employer a fixed maximum monthly payment that covered the administration and all the incentive dollars and still lowered their total cost by 21%. And that means they went from a 17 renewal to a -4. And then what happened in year 2? Well, because more employees were seeing higher quality doctors that lowered the total cost of care, their claims fell by so much that they got a -8% renewal from their carrier, and that compares to +8% for the average in their region. So this employer got 16% additional savings, which meant that the premium was 38% lower in the second year than it would have been with their old benefits. And so that's really the key. And it's not just the cost savings, but it's also the employee experience. You see here 14% increase in participation, an 83% engagement rate, and 99% employee satisfaction. And of course, that's just one case. We also see employers that have existing tax incentivized accounts, HSAs or HRAs, replace those with a higher functioning Garner incentive account. And here you can see the cost per $1,000 of coverage is significantly lower with Garner than doing an HSA or an HRA match. So overall, the impact of Garner is to restructure the benefits, drive more care to higher quality, and lower that total cost through time. So what we've seen is that the average 250 life group will save about $2.7 million in the first 4 years by switching to a Garner-centric plan design. And of course, on top of that, we also improve the employee experience and improve health outcomes for members. So I hope that's helpful. As we always love to hear from you. If you have questions about how our program works, anything about this, or if you have groups that you think might be a fit, please feel free to reach out. I always love to hear from you all. Thanks so much.